All right, guys, welcome to another exciting edition of Talking Retirement. We are NJ Life and Health as always, and we are here with one of our favorite people and one of Ocean County's best reviewed Medicare brokers, Jo Gallo. Thank you so much for joining us today.
Thank you, Ken. Thank you for having me.
Yeah, so we're super excited to have you because we have a big myth we got to crush today, right?
Yes, we do.
So
yes,
what is that myth? Can you tell?
Well, I'm going to tell you. The myth that is kind of just everyone has it embedded in their memory is the fact that they can't change their supplemental insurance until AEP, otherwise known as the annual enrollment period. That is a myth. That is a myth because by law, by federal law, you can change your supplement plan any month in the year.
Really?
Really. It's not, we need to bust the myth.
Okay, we're going to bust this myth
Bust
today.
that myth.
So that goes beyond your company, your Plan G, your Plan F, your Plan N. Any Medicare supplement here in New Jersey, you can switch all year long.
Correct. It's, it's almost becoming something that needs to be shopped now.
Really?
You no longer stay with the same plan because while you stay with the same plan and you want to stay with the same plan, it's almost become like car insurance.
Okay.
The prices are going up and it's becoming unaffordable. So you have a choice. You can either jump out of your supplement plans where you were very safe.
Yeah, I think a lot of people come to us and want to make that switch from a Medicare supplement because maybe they're a little bit older, 70, 75, 80, their Medicare supplement. Maybe it's even something like a Plan F. It could be $250, $300, $400 a month. And they're like, well, I can't afford the supplement. Throw me an Advantage. And we say, did you know we can give you a similar supplement for like $150, $200 a month? And they go, well, okay, that's enough for me to stay within the supplement system. So can you elaborate a little bit about how you would make that switch?
Sure. So basically, the first time you join Medicare, you join without any questions. No questions asked. Come on in. We love you. After that, you will have to answer what's referred to as medical questions. Now, medical questions are concerning very large issues. They're not small issues. We're talking anything to do with your heart, anything to do with your pulmonary system, your lungs, your blood, your organs, your disease factor, if you've gotten any, had any, or so on. Other than that, if you feel like you're living a clean life and you're healthy, you're not facing any kind of turmoil, then yes, you will pass those medical questions. But we will not get to find out unless you give us a call.
Yeah.
Because if you don't pursue it, nobody's going to call you and say, hey, you're paying too much. Want to pay less?
Yeah, exactly. And I think it's interesting you say that because you say, oh, you're going to have to pass health questions. And people go, well, I take one cholesterol medicine. I'm out. And it's like, no, you're probably okay.
Yeah, but you can actually sorry to interrupt you, but you can actually be taking a cholesterol med, a heart med, and I don't know, maybe something thyroid related or what have you. And you're going to pass those medical questions.
Yeah.
It's not something that's taken lightly. They are big issues, not small.
Yeah, and I find it interesting too because even if you have one of those big issues, let's say you just had a heart attack, let's say you had cancer, in some instances, as long as you wait 2 to 5 years, you can switch a little bit down the line. So we've had clients where it's like, okay, you've been cancer-free for 1 year. We're going to put you on the calendar a year from today, and chances are we can switch you somewhere,
Correct.
that kind of thing.
Absolutely. And that waiting time is only 2 years on some issues, 5 years on other issues, but it still gives you the opportunity to save money without having to ditch your supplement plan to an Advantage plan.
Exactly. I think one of the biggest concerns people have is we talk to them about switching. We say, we have to specify that if you have a Plan G, whatever it might be, it's the same across companies, but people might have one company and they say, okay, well, this company has paid every bill ever. Why would I switch? And we have to take a step back and say it's actually not the company. So can you shed a little bit of light on that?
Sure. The one thing that we try to explain to folks when they come in for their initial Medicare education is that a Plan G is a Plan G is a Plan G. we do reference it or refer to it as Skippy peanut butter, using the brand there. So using the brand there, Skippy peanut butter, if you buy it at one store, you may pay $1.99. If you go to a convenience store, you may pay $3.99. But when you get home and you make that sandwich, you're making it with Skippy peanut butter. And it really doesn't matter where you bought it from. A Plan G or a Plan N or a Plan F, whichever plan you have, is just like Skippy peanut butter. It's not going to change. It's federally mandated, regulated, and once you're in it for life. Okay? But it's up to you to save money if you want to. So we're saying that a Plan G is a Plan G. If you come in under one carrier and you feel like that carrier has done an incredible job at taking care of you, you have to realize that another carrier is going to take just as good care of you.
Yeah, and I think one of the coolest things is, let's say you're in one carrier that you like and you switch to another carrier, and let's just say we'll just say Company B or something like that. Because you have Original Medicare, if your doctor takes Original Medicare, even if they don't take Company B, they still have to take that Medicare Supplement, which is a pretty interesting dynamic because, you know, sometimes someone says, well, I don't think my doctor takes that. It's like they take Medicare, so they do take that company. It's the one instance where they're actually going to, which is pretty cool, right?
No, absolutely. And I agree. That has become a little confusing at most of the doctor's offices if they look at a plan from a company that they've never heard of. As long as you're referring to it as Original Medicare, they should understand that Original Medicare covers you for everything, everything medically necessary, regardless of who the carrier is. These plans, again, are federally based plans. Yeah. Medicare supplement plans, you know, you can change them anytime during the year. You are paying for them.
Yeah.
Yeah, but bringing your costs down, once again, is getting like car insurance. You're going to shop costs, and we push everyone to do it. It's worth it. Saving $600 a year is a lot of money. Saving $1,200 a year is even more money, but you'll never know unless you give us a call.
Yeah. Call Jo Gallo.
Call Jo Gallo.
Yeah. No, I think it's interesting because people have such trepidation for good reason. You know, people don't want bunk health insurance. They don't want to not be able to see their doctors and everything like that. But we've done this so many times. We just know in the back of our heads it's going to work. If you're truthful during the process, everything's going to transition over. So what do you tell people who are like, I know it's federally mandated. I trust you. I know this is how it goes. I still don't want to do it. Like, what's the...
I find that if I actually show them, it's like leading the horse to water. I take them to the actual Medicare and You book that's provided by the United States government, showing them exactly what it says in the book, that these plans are all basically the same. There are no differences. And it does not matter what state you live in or what the carrier is. Showing them, letting them read it for themselves in the book so they fully understand it, and then eventually getting them through underwriting by putting in an application and them seeing the difference in what they're paying, that becomes like the greatest word of mouth. But not a lot of people, I mean, most people are just kind of afraid. They're apprehensive about, you know, the idea of change. I understand that, but I really want people to start looking at this like car insurance. If it's getting too high, you got to make a move. Well, you can, because once again, you can do it any month of the year, but if you cannot pass those medical questions, you're going to stay in the plan you're in.
Yeah, and a quick aside, there are certain states where the supplements are slightly different.
Massachusetts,
yeah, slightly different. But I think it's interesting because even within the past couple months, you know, we had a couple specific insurance carriers we were like ride or die for. And we were like, we're going to put you in this one at 65 because this is who we want you to keep for like 5 years. And we'll always like run the numbers, but we trust these. And a lot of companies have kind of thrown caution to the wind and just said, we're going to raise rates like crazy. And for us now, it's like, okay, even within the past couple months, we've just decided to say, hey, we're going to try to switch you every single year. And we might even try to do it mid-year if you start to see or notice come up that it's going up, because we're like, let's get ahead of this now, because we have to dive into underwriting a little bit more, because there are times, like we talked about, where you can't switch.
Correct.
But you know, you want to try to switch while you can, basically.
That's it. That's it. If you're going to say to yourself, well, you know, my costs are getting high, I always say to my customers, take a look at your life and take a look at the people in your immediate family. When did mom and dad get diseases or get sick or get whatever? These are the things you need to look at and compare to yourself. I also, as hard as this is to tell some people, you really need to look at how you're taking care of yourself. The better care you take of yourself, the better you're going to be off and the better you will do going forward.
Yeah.
You won't be so overwhelmed and sick so fast that you can't get out of the plan. And then by the time, you were looking at 20 to 25 years, from 65 to 85, 90 if you're lucky. This is a long time to be in one insurance company, especially if they're going to go up every single year when you get older. Each year you age, each year the plan goes up. By the time you're in the plan for 5 years, you may have gone from $120 to almost $200. You need to do the switch while you can, while you're healthy enough, and straight through. I would tell anyone to change every 2 years or every year just to keep their costs down. Yeah. And once again, a Plan G is going to be a better price in just joining the plan versus staying in the plan. Mm-hmm. And a Plan G is Skippy peanut butter. Plan G is a Plan G. It's not going to change. A Plan N is a Plan N, and a Plan F is a Plan F.
I think one of the most common switches we try to do is getting people from a Plan F to a Plan G.
Correct.
Because a Plan F, while there are no out-of-pocket costs, which is
wonderful.
Awesome,
yeah,
it is usually more money. Because a Plan G, the only cost is a $240 deductible, but
right.
A Plan F usually costs more than $240 a year extra. So can you shed some light on that F to G transition?
Sure. Like some older plans, J, F, the F was discontinued on January 1st, 2020. And because it was discontinued by the federal government, it's tending to go up higher, quicker. Mm-hmm. It even starts at a much higher rate. So if someone was more interested in a Plan F prior to 1/1/2020, their Part B date, they could join that plan, but we will tell them exactly what's going to happen, which means that normally you might be going up between 12% and 22%. With a Plan F, you may go up between 25 and 35%. Who knows? It's not up to us. There's no federal mandate on how much the increases should be, have to be, need to be, whatever. We're at the mercy of the carriers. Mm-hmm. Okay, the plan has to be the same. The price up to the carriers, no one else.
Yeah, it's interesting because to hit off that point, let's say a Plan F, it's been discontinued. One of the reasons it goes up so fast is they're not bringing in any new healthy
right.
people to offset the cost. So, since you can't get a Plan F anymore, you have to have started Medicare prior to January 1st, 2020. A lot of people are currently in a Plan F that are older. They might have higher medical bills, but there's no new 65 and under people coming in to offset those bills. So they have to raise the rates much faster. Correct. If you're switching every couple years, you're putting yourself into a new position basically every single time,
Right. And going from a Plan F, which again covers all your costs, to a Plan G, with the only difference being a yearly deductible. And once again, that's a yearly deductible, not a monthly deductible, not a per person deductible. It's per year. This year, it's only $240. If the difference in your Plan F and your Plan G is $50, that's $600. You already saved $360 by just changing plans and paying the Part G premium. Mm-hmm. Same thing on a Plan N, which is kind of like a little less comprehensive than the Plan G, because not only do you have the $240 deductible, but Part 2 to that is that you also have a up to $20 copay, and then icing on the cake, you're subject to what's referred to as 15% excess fees. But those excess fees can be explained in detail so that you understand when you make your appointment to come see us.
They are rare, but they do exist.
Yeah, they are rare, but they do exist. Correct.
Yeah.
Correct. I've only run into one time in my career selling insurance that someone charged 15% overage fees. So I think the Plan N is a bargain and a half.
Yeah, it's interesting because, obviously there's risk with any insurance policy, but I've seen people on Plan N's get 6-figure heart surgeries and chemotherapy. And
never pay a dime.
Exactly.
All right.
It's great.
Same thing. Same thing as a Plan G, same thing as a Plan F. The coverage is great. It's
awesome.
The most wonderful coverage you can have.
Yeah, I'm 30 years away from 65. I'm looking forward to it. It'll be a good time once I can. Yeah. So something we want to talk about going into 2025 is, we've covered this extensively at times, but I want to get your take on it. A lot of CEOs and CFOs of these major insurance carriers have more or less signaled Medicare Advantage isn't going to be quite as good next year. And it's due to a lot of changes. We have articles we can show you guys about, the changes to Medicare and the $2,000 out-of-pocket max. But what should people in Medicare Advantage plans in 2025 expect? Again, this is all speculation based on what these carriers are saying, but like, what's kind of your prediction for Medicare Advantage?
Well, I think we may see premiums. I think there will be $0 plans, but there's going to be less over the counter. There's going to be less perks, like no gym, offering, no additional dental over a cleaning per year. I would say that's like part of the downside. Besides premiums, I do believe that we're going to see higher copays. Doctors are wanting more money. We saw a big mishap in this past couple of months between Aetna and Hackensack Meridian Hospital, and it's all resolved now. But the major issue is a lot of people were very scared that they were not going to be able to see the doctors that they wanted to see, or see them at the hospital that they wanted to see them at. I mean, this is a big headache for people that are in these plans. And these plans, because I guess they're not paid for, and they are provider built and offered, unlike a supplement plan that's mandated and regulated by the federal government, these plans are not. The carrier gets to tell you what's going to happen in the plan. Because of that, there's no way for the federal government to say what you're going to get, if it's going to be more or less or whatever. We are at the mercy of the carriers. So I tell everyone that has a Medicare Advantage plan going forward to make the call this year. Make the call, because you don't want surprises. If you're one of those people that gets the explanation of benefit in the mail and puts it in your file or puts it in the round file, this year would be the first year where I'd really stress that you need to compare your explanation of benefits last year over this coming year of 2025.
Yeah, I definitely agree. And I think it's interesting because I think a lot of people are going to switch to and from this year, because I think a lot of people are in Advantage who might say, well, I was doing it because of vitamin benefits and dental, and that's not quite as good. I'll switch to supplements. And I think we're also going to have some people who more or less get priced out of supplements too, which is sad to see. So I think it's going to be a big switch over the course of the year.
I agree with that 100%. It's going to be a very, very busy annual enrollment period. I urge all of you to make your appointments early, get a slot. We're all going to be taking new customers. It does not matter. Just give us a call and talk to Amy, and she will book you an appointment.
And it's interesting too, because of all these regulations that are changing, we might not even know the scoop until like September or something like that.
Yeah, that's the one stinky thing for us as agents and brokers, is that we're not going to find out what those plans do, what they do, what are they offering this year versus last year, until right before the annual enrollment period of October 15th. So, again, an early appointment is a smart appointment, but we can't change plans until October 15th. But you can learn what you want going forward. In other words, checking to make sure that your doctors and your hospitals are in the network that you want to be in, or if you have to change out of your network in order to be in the plan you want to be in, which I hope none of you do, but that's what you're going to have to do early on to make sure that you're getting the right coverage you need or you want going forward.
Awesome. Well, Jo, we appreciate your insight. You've been helping people in Ocean County for so long, and we always like to see your takes on everything. So thank you so much for coming on.
You're welcome, Ken. You're welcome very much, sir.
If you'd like to reach Jo or any of the brokers here at NJ Life and Health, you can call us at 848-226-6897. We're based in Toms River, New Jersey, right here in Holiday City, or you can visit our website at www.njlifeandhealth.com. So once again, Jo, thank you so much, and we'll talk to you soon.
You bet.